Hi there, I'm Renos Vakis, lead economist at the World Bank, and your host for Accelerating Development, Ideas for Impact. This is not your typical podcast. It's an AI-powered conversation brought to you by the World Bank Institute for Economic Development, where we unpack the latest research with one goal in mind, turning big ideas into real-world impact. Let's get started.
Thanks for the intro, Renos. Welcome, everyone. Today we're exploring a truly vital question, one that sits at the heart of effective public policy. How can we make public health information, or indeed any crucial development message, truly lead to positive action and behavior change? The COVID-19 pandemic, as we all experienced, really highlighted this challenge on a global scale.
Indeed it did, and thankfully, we now have robust research emerging from that period that offers some powerful answers. A recent, very comprehensive global study on COVID-19 vaccination messages is particularly insightful, and what's fascinating is how it builds upon and validates long-standing insights from the World Bank, particularly those highlighted in the 2015 World Development Report, Mind, Society, and Behavior. That report stressed, quite rightly, that people don't just operate on information alone. Our thinking is often automatic, deeply social, and shaped by pre-existing mental models.
So this new COVID study offers concrete evidence for those principles. What were some of the headline findings that policymakers can really learn from and apply?
Well, first and foremost, the study unequivocally shows that behaviorally informed messages work. They significantly increased people's stated intentions to get vaccinated. On average, the odds of intending to vaccinate were about 28% higher in groups receiving these messages compared to a control group. That's a substantial impact, especially when you're trying to achieve widespread public health goals. And importantly, it wasn't just any message that did the trick. How the information was framed and who delivered it was absolutely key.
That's a critical distinction. So, what were the most effective messaging approaches that the study identified? What really resonated with people?
Well, messages that leveraged trusted voices, for example, those from experts and religious leaders, had the largest impact, boosting the odds of vaccination intention by a striking 45%. This really underscores the power of thinking socially, a core concept from the WDR 2015. We are profoundly influenced by those we perceive as credible and authoritative within our communities. Also, very effective was what the paper calls endemic framing. These were messages that acknowledged COVID-19 as an ongoing reality, rather than a temporary emergency. This approach increased the odds of intention by 42%, likely because it aligned better with people's evolving mental models and their lived experience of the pandemic.
So, leveraging trust and ensuring the message is relevant to people's current understanding seems crucial. Were these findings consistent across all the different countries and contexts the study looked at?
Not entirely, and that's a very important lesson for policymakers. While the overall impact was positive, the effectiveness of specific message types did vary across the 23 countries studied. For instance, safety messages, which emphasized the safety of vaccines relative to the risks of COVID, were highly impactful in a setting like Papua New Guinea, increasing the odds of intention by up to 93% in that particular context. However, this wasn't a consistent finding everywhere. The average effect of safety messages across all studies wasn't statistically significant. This highlights that local context, local anxieties, and existing levels of trust really do matter. Furthermore, even within populations, some individual differences emerged. Expert messages tended to be more effective with younger people under 40, while pro-social messages emphasizing community protection resonated more strongly with women. So the clear implication is that a one-size-fits-all campaign strategy is rarely going to be optimal.
That's a critical point for designing any public campaign, not just in health. Understanding that heterogeneity is key. So, with these findings in mind, what are the actionable takeaways for policymakers listening today? How can they translate this research into more effective strategies on the ground?
I'd highlight four main things. First, actively identify and strategically use trusted messengers. Don't just assume who they are. Find out who people in a specific community genuinely listen to. It could be health experts, local leaders, religious figures, even celebrities in some contexts. Second, tailor your messages meticulously. This means adapting them not just linguistically, but also culturally, ensuring they resonate with the specific context and the current mental models of your target audience. What are their primary concerns? What are their existing beliefs?
So, deep audience understanding is non-negotiable. What are the other two takeaways?
Third, policymakers should really embrace rapid testing and adaptation. The COVID study itself is a great example, using online experiments to quickly gauge what messaging approaches were most promising before potentially scaling them up. This iterative approach, learning as you go, is much more effective than launching a large, untested campaign. And fourth, it's crucial to think beyond just providing information and consider the choice architecture. A key concept from the WDR 2015. How are choices presented to people? Are there ways to make the desired behavior easier, more intuitive, or the default? This involves understanding the journey from intention to actual behavior and addressing potential hassle factors or behavioral biases that might get in the way.
So, it's really about being smarter, more nuanced, and more adaptive in our communication efforts, moving beyond simply disseminating facts.
Exactly. The COVID research powerfully reinforces the idea that understanding human psychology in the social context is absolutely vital for effective policy design and implementation. Even relatively small, behaviorally informed changes in how we communicate or how we structure choices can lead to quite significant and positive impacts on public health outcomes and other development goals.
It certainly sounds like these behaviorally informed approaches aren't not just a side note, but increasingly essential tools for anyone serious about accelerating development and improving lives. A lot to consider. Over to you, Renos.
Thank you for joining us. You can find the full report on our website. Just follow the link in the description. Be sure to subscribe to be the first to know about upcoming episodes. And before you go, how do you plan to put what you learn into practice? And what topics you'd like us to explore next? We'd love to know. Until then, goodbye.